Okay, you are all set, at least.
All right, thanks, Frank. All right, we'll go ahead and get started. Frank did head count. We do not have quorum tonight, so we'll skip approval of minutes. So we'll start with introductions. I'm Elise Schweitzer. I'm the chair of the board.
Sally McConnell-Cheney, member of the board.
Jessica Connor, member of the board and mental health subcommittee member.
Randy Brown, Thompson County Legislature and member of the board.
Travis Winter, member of the board.
Fran Palazzo, LGU Administrative Assistant.
And I'm Frank Kerr, the commissioner.
August Upland, member of the board.
I'm Jan Lynch, member of the board and also on the mental health subcommittee.
And Larry?
Larry needs to be
Oh,
let.
Larry's waiting to come in.
1 second. I will let Larry in.
I wouldn't miss this one.
Hi, Larry. Do you have audio?
Yes.
Okay, we're just doing introductions. You want to introduce yourself real quick?
Oh, I'm Larry Roberts. I'm a member of the Community Services Board and the chair of the Mental Health Subcommittee.
All right, thanks. And we will, we'll get to our guests in just a minute. We'll just push through these other agenda items first. Anyone have any additions, changes to the agenda for tonight? Okay, we're not going to approve minutes. Privilege of the floor, questions or comments from board members or guests? Larry, did you have your hand up?
So I have two things to ask about or to ask us to put on agendas going forward. One is the mental health subcommittee had a good conversation with the ACT team, with the Mid-Lake ACT team, which is the ACT team that serves Ithaca and Tompkins County and some other counties. Their offices are located in Ithaca. I had assumed, I don't know why I assume these things, that they had expanded their services to cover more of the county. It turns out that that's not the case. So I would like for us to have a conversation at a upcoming meeting about how to expand the ACT services to the rest of the county. As I heard some explanations for why that wasn't the case that I had never heard before at our recent meeting, and I'm a little at loose ends for how to work with the state and EPC about getting better coverage for the county. And the second thing, and maybe this is an easy update, I don't know if people notice, but CARS is now part of the Hugo Health system. And I was wondering what that means in terms of both the organizational structure and its sort of daily operations.
Okay, so you'd like maybe a representative from CARS to come and give an update on that?
Or if it's an easy update, you know, like if Frank can say something, or if, you know, they could even send us a letter saying what was, I mean, I don't know how big a deal it is. I just noticed that that's something that happened.
I can give what I know under my report, and then if you'd like more, we could always invite them to come.
Okay, all right, thanks. Anything else, Larry?
No.
Okay, I just had a minor thing that I wanted to let everyone know about, which is that we'll be adding committee reports back to the agenda every month. That at some point fell off, and I'm going to put it back on. So if committee chairs can be prepared to give brief updates at the next meeting, that would be great. We don't have it on the agenda today, but that's okay because we have a full agenda today anyway.
At least with Stu, you have a quorum. So if you'd like to do the minutes.
Oh, okay. Yeah, let's back up. Stu, actually, do you want to, we introduced ourselves briefly. You want to do that? And then we'll go ahead and we'll give everyone a minute to. look
Sure.
at the minutes.
I'm Stu Bergman, member of the board. I also chair the Substance Abuse Subcommittee.
Thanks.
Friendly.
That's okay. All right. So we'll go back to the minutes.
Make a motion to approve the minutes as presented.
Okay, any second? Any further conversation about the minutes? Okay, all in favor of approving the minutes as written? Okay, minutes approved. It's easy. Okay, correspondence or announcements? Okay. All right, okay, so hearing none, we'll go ahead and get right into it. So we have some guests from Challenge / Mosaic with us tonight to talk about their new cannabis license and dispensary plans. And Ashley and Alan, I'll just invite you guys to unmute and maybe introduce yourselves a little bit and your role at Challenge / Mosaic. And then I think it would be nice first just to hear from you. And maybe you could just give us all, you know, a description of the initiative so that we have something to base questions off of, or, you know, whatever people want to discuss.
So I am Alan Connolly and I am the CEO of Challenge. And so we've been working together with Mosaic for the past couple of years. And so this is a new initiative for Challenge specifically in Tompkins County.
Hi, I'm Ashley Burke. I'm the Vice President of Business Operations at Mosaic and Challenge. Can I share my screen?
Sure.
Okay. Are you able to see that okay?
Yes.
Yes, we can now.
Okay, great. All right, so this is just a quick intro about our new business. So we've created a separate LLC that is wholly owned by Challenge, and it is called CWS Holdings One. We have a DBA that was filed for the name Aspire. So this is just a little bit of update about the law changes, just so that everybody's aware of this. All right, so the Marijuana Regulation and Taxation Act was signed into office in March of 2021. So this legalized cannabis and created the Office of Cannabis Management, which is governed by the Cannabis Control Board. So to date, as of March, they have granted 3 conditional licenses in Tompkins County for a dispensary. 1 dispensary is currently open in the county. There are 14 conditional licenses for cultivators, so that is the growers of cannabis. And there's 1 conditional license for a processor in Tompkins County. So this is a quick just summary of kind of where we've been and where we're going. So we received our conditional license in November of 2022. We had spent a few months after that, obviously doing a lot of research and looking at locations. So we identified a location and received approval from the Office of Cannabis Management in February of this year. And we received City of Ithaca approval for our location in March. So we have quite a few next steps, but the big one is really working with our architect on our design and build out plan for our location. And once we have that information, we'll be able to put together a better timeline for our opening. So we've created a website. It's called www.aspirecannabis.org. And this is where you can sign up for mailing lists for updates. We have jobs posted on there, and we're going to be just having a lot of information coming as we get closer to that opening date. So I encourage you guys to all go there and check that information out. It talks a lot about our mission and our history. And then the other major step that we will have is submitting for our final license. So that is also in process. We're hoping to have that submitted this month. So the vision for our store is really a boutique style shopping experience. We're looking at multiple ways to serve customers. So we'll have online ordering with an express checkout. We'll have in-store kiosk ordering, as well as in-store shopping supported by our staff that will be well-trained and be able to answer any questions. We are working to build really strong partnerships with a lot of local suppliers. We've been doing that really since day one. Customer education is a critical and primary focus for us. So we'll be using those relationships with our suppliers and having them participate in events and really build upon the education. There's a lot of very interesting science behind cannabis, and based on the effects that someone's looking for, there's different terpenes and strains that will give that desired effect. We are also really focused on regulation. So we're working really closely with our legal and finance team to make sure that we have everything covered as far as compliance with the regulations that are ever changing, but hopefully those will be finalized here in the next couple of months. So we're also going to be adding quite a few positions. We have full and part-time management positions. We'll have customer service positions that will be full and part-time. And that's looking to be about 15 to 20 positions. Obviously, that'll be dependent on the demand and the traffic that's coming into the store. We are also really focused on employing staff with employment barriers so that we can continue to support them through our challenge business. So we're starting to collect applications and we're really excited. These positions are going to have competitive pay and also benefits, which for a lot of people who work in the retail space, that's not very common. So we're looking to offer paid time off, insurance, health insurance, dental insurance, holiday pay, all of that. And so ultimately this business, any profits that we are able to obtain will go back to support Challenge in our various initiatives that we're working through there. We are working to develop a college-based program where individuals can obtain some experience on a college campus. We also are looking to expand services and be able to add more staff to really continue to focus on supporting people who are looking for positions and trying to learn employment skills. So that was just a quick little summary of kind of where we've been, kind of next steps. We're really excited about this opportunity. I think the community's been really very supportive of this. We've talked with a lot of people that feel that, obviously there's going to be 3 dispensaries in Ithaca, and knowing that ours is ran locally and the profits are also staying locally to support a nonprofit, I think is a really good story that people are really excited about supporting us and partnering with us. So, we're still looking at a summer opening. We still have a lot to do, but that's just kind of the quick update. So I'll turn it over to you for any questions that you guys have.
Okay, thank you. I'll kick it off with a question and then I'll open it up to anyone else who wants to ask some questions. So, my initial question is, and this of course predates either of your involvement with Challenge, but you're probably aware that Challenge has a very checkered past when it comes to success of social enterprises. And in the past, social enterprises were not rolled out in a way that protected the bottom line of the agency. So what happened was business losses became revenue losses that came out of program dollars. And so you've made an LLC. And so my question is, does the formation of the LLC protect Challenge, the agency, from any potential negative revenue losses that the business might experience?
That is correct.
Okay, I saw you shaking your head. Okay. I didn't want to talk over you. Yeah, and I think that to add to that, so I oversee all of our businesses at Mosaic, and that is definitely not the case. I've worked with our agency for over 15 years. So I think, like you said, we were not a part of those decisions in that business planning, but I'm very confident in our abilities to run successful businesses. We've been doing that for years at Mosaic, and we've already turned around a lot of the deficit programs at Challenge by our leadership.
Any other questions? Larry?
You're on mute, Larry.
So I have a few questions. One is, well, one is a recommendation, and that is that it would be good, I think, for someone from the business to attend regularly the substance use subcommittee, just to keep the substance use subcommittee up to date about what's happening. And you notice I said substance use subcommittee, not substance abuse subcommittee. I wonder if you could talk about, well, something intrigued me. You said you have turned around a couple of the business that were problematic. So I wonder if you could talk about that. The other is if you could just talk about how you came to a decision that this was an avenue you were going to pursue. I'm also interested in knowing who are these people who are excited about hearing that this is happening. And my last question is, can you talk about how you intend to employ people with employment barriers, particularly people with disabilities and people who have who are in recovery from substance use problems?
All right, so that's a lot of questions. Let's see. I'll start some of them and then I'll let Alan chime in. So in regards to turning around business at Challenge, we really did a deep dive financially at all of our programs, and that resulted in some contract negotiations and some price increases with a lot of our customers, just to better explain to them really our costs. Unfortunately, the prices that we were charging prior just were not even covering our our direct labor costs, let alone any overhead and admin. So that was really the first step. But we've also looked at all of our departments. So through our management service agreement, Mosaic is providing a lot of the back office support. So what that means is, Challenge didn't need to have their own, director of IT, director of HR. We were able to support all of those functions with our existing staff. And with small nonprofits, typically they have to have someone, even though they don't necessarily have enough work for that full-time person, but they need that technical skill. So that's, I think, where a lot of these nonprofits struggle when they're small, to be able to cover those costs. So Alan, did you want to add anything else about the turnaround at Challenge?
No, that's exactly it. And when you look at what we've done in the past couple of years, all those things that Ashley had talked about have been done. And we've continued to do those in terms of net assets for that particular organization. They've turned to a positive about almost 900% because of the way that we've been able to manage that organization, take off a lot of the administrative overhead, and be able to put back into that organization really methodical, thought out positions in terms of managing the current businesses that they have, and to increase those opportunities. And of course, it's helped that we've been able to somewhat get out of the COVID-19 issue. That's been obviously helpful, although it's still a challenge. And I know all of you that work in this industry, that continues to be a challenge. We continue to be quarantined in various areas, but all those things put together has been very positive for Challenge.
Yeah, and we've also, I think, I can't remember what they said, but it had been years since the staff were able to get any pay adjustments. So we've been able to, not only improve the bottom line, but really improve the labor at Challenge through, new IT equipment, new vehicles, pay increases. So I think, really focused on a lot of those initiatives. It has really, made some great positive impacts at Challenge.
Great.
So
And then
any
I think,
questions on-
Larry, maybe the other part of your question was, if I'm rephrasing it correctly, why cannabis essentially? Is that?
Yeah, how did you come to sort of understand that as something the Challenge Mosaic wanted to pursue? My other questions were related, which is, you said that there were a lot of people who are excited about this. I'd like to know who those people are. And thirdly, I'd like you to talk about how you see people with disabilities and people in recovery being part of the staff.
Yeah, so really, I mean, for us, we're always looking at new business ideas. You know, I don't know if anyone is familiar, we also purchased the small business in Ithaca called Shelter Pups. So that was a small business where they make custom replicas of your pet. So that's a business we purchased last year. And, you know, just continuing to look for opportunities to bring in revenue to support our agency, but also to offer employment opportunities for people with disabilities and other barriers. So this was just another one of those ideas. You know, we do custodial, we do lawn maintenance, we do lots of different things at Mosaic that we are also thinking about expanding into Ithaca. Our biggest issue right now is, you know, space. We don't have a place to store all of our equipment and that sort of thing. So those, you know, are some struggles that we're going to have to overcome. But I think, you know, under Alan's leadership, this has been our focus for all of our agencies, is to really look at opportunities to bring in additional revenue to support our mission. We're primarily funded by federal and state funding that is always getting cut. And in order to be able to offer competitive wages and unique programs, we have to continue to look for outside resources and primarily business divisions.
Okay, and thanks. And Larry, I think we had a hand up in the room, so I'm going to cut over. Travis, did you have a hand up? No. Oh, you did. Okay, sorry.
Yes, thank you. I was curious what your initial investment is for this company and where did it come from?
Yeah, so our initial investment will be a loan from Challenge. We're still working out the final details because we just did enter into an agreement with the architect firm. So once we get the final design drawings, then we'll be able to solidify our budget a little bit better to really develop that loan.
And that is something that we have to fund ourselves, which is different than other funders. If you want to explain that, Ashley.
Yeah, so the state created a DASNY fund for the social equity applicants. So New York State is really focused on the war on drugs and really helping those people who've been wronged by criminal convictions to start these businesses. So they're hoping to have at least 50% of the dispensaries be owned by someone who had a previous conviction for marijuana. So they created this fund through the DASNY fund, where they are helping those folks to obtain property and renovate property and also set up all their behind the scenes operations. So whether that's point of sale, legal things, trainings, they have a whole bunch of different things that they're offering these conditional dispensaries. Unfortunately, the nonprofits were not included in that, so we were not able to access any of those resources.
So we fund all that development ourselves, and it's obviously challenging to do that, but we felt like, you know, being in Ithaca, wanting to have a community-based partnership with Ithaca, it's important that you know, we put our money where our mouths are and we invest in the community ourselves. So that's what's happening. Unlike other dispensaries that don't have to do that, we are.
So is the intent that the LLC will then repay Challenge?
Mm-hmm. Yep. It'll be an interest-bearing loan.
Okay.
So who are these people?
Hold on a second. Just 1 second, Larry. Jan?
You talked about services and coming up with things that were more profitable. So it's my understanding that you no longer do school transition services, which left a gap in our community. And I'm wondering, is it in the plan to use some of what you make to come back into doing full services?
Well, during the time that COVID occurred, we had to take a look at the business to survive. And so during that time, and I don't know all the technical details, so I hope I don't misspeak, but we have had to look at all of the services that we had because we were in a deficit, and pretty severe deficit. So the intent is with these other businesses that we are able to be able to get into and have a surplus or a profit, to be able to fund back either new initiatives, as we were talking about college experience that we're having with people with disabilities, or to modify those existing programs that we have so that we can support those. That's the whole purpose of really what we're doing is to be a community partner, a community resource. But before we came in, there was some, and you intimated that before, there were some severe financial issues that were going on with the organization. And so from our perspective, and for many nonprofits that are small, those that are even large, looking for diverse revenue streams to support the mission of the organization. So again, we look at ourselves as a business with a social mission model. So we balance the mission side of the business to those that are on the financial side. And we have to marry those two and balance both of those, because if you go so far into the mission, you may not be willing to do the things that you need to do in order to keep the mission going into the long term. If you go so far into the financial side of it, then everyone and everything within the mission becomes a number. And we don't want to be that either. So we do the best that we can to balance those aspects so that we can provide mission going into the future.
So it's interesting, though, that you want to do a college initiative, and yet you're not doing the support services for students who are transitioning out of high school. How did you come to that decision, that college prep or taking kids to college?
And if I could just tack onto that, is it a TIPSID? So is it a college experience for students with intellectual disabilities, or would it be a matriculating credit-bearing supported education program?
So that is not an area that I oversee, but I guess unless Alan, do you know the specifics of the funding for those?
For our new initiative, because we've gotten
Or
a
like,
grant
yeah.
for the short term, and then some of it depending on what type of individual comes in, could be OPWDD related, depending. So it's a combination. Also trying to work with local school districts to allow that, because there's that gap between the 18 and 21-year-olds. And we've been pretty successful with that particular program with Keuka College in Penn Yan. And it's been going on for how long, Ashley?
At least 10 years. Yeah, at least it's a partnership between Keuka College, Dundee Central School, and then us.
So we'd like to do that here as well.
Right. And I believe the one at Keuka College is a college experience program, but it's not vocationally focused necessarily.
Correct.
I'm not positive about that, but
Yeah, they do
okay.
some vocational, but again, that's OPWDD funded.
Okay. Yeah. And I guess I'm going to kick it back to you in a second, Larry, because I think you had another follow-on question, but I think, maybe as a point of advocacy, coming from this board, post-secondary transition to employment is something that is really hard to come by in Tompkins County right now. I don't believe we have a current vendor of pre-employment total package of pre-employment transition services. And I know that was problematic from a revenue point of view. I had a long conversation with Briggs about that at one point, about how, and it's no surprise, other agencies experience that with VR funds as well. But, there's maybe if there's a creative way to look at using some of that funding to support post-secondary transition of students with disabilities to either to education in terms of matriculating and or competitive integrated employment. I think that's a huge need in the community right now. It's a really big gap.
Great. I think that's a great area. And you're right. I think that is always a funding gap as well. So I think that, this could be a great solution to some of those issues.
Larry, did you have another question?
Oh, I
You're
think you're
muted.
on mute still.
Muted still, Larry.
So my last two questions were about who are these people who are excited about working with Challenge? That's interesting to hear. And then also, how are you going to work to make sure that a significant percentage of the people who take these positions are people with disabilities or people in recovery from substance use?
Yeah, so a lot of the people that we're working with closely are primarily in the cannabis space that are very excited about this opportunity to work together as a partner to supply us, but also to really have that relationship where they're going to be present at the store to be able to answer questions and really educate the customer. But we've also had really great feedback from the local government, community members, the press, the media. Pretty much, I mean, I feel like Ithaca has been very supportive of cannabis in general. So really, I think that we're just differentiating ourselves from the other dispensaries by being a nonprofit. And then as far as employing people with disabilities, I mean, that's what we do on a daily basis in all of our businesses. I'm not really sure exactly what you mean, but we will definitely be looking to work with people who have a variety of different barriers. We started making some categories of different barriers, and really, when it boiled down, pretty much everybody could probably fit into something. So, looking at people with a physical or a mental disability, obviously, we work with a lot of people who've had past criminal convictions, transportation barriers, language barriers. So this is just really another business that we would employ people just like we would at our contract staffing, shelter pups, as well as what we do at Mosaic on a daily basis.
So I think Ashley, you were saying that at least right now, we are one of 3 nonprofits in the state, the whole state, to be able to six now, because originally there were 3, and then there's, I think, did I get that right, or always 6? Always 6.
Yeah, there's always been 6. There's 3 dispensaries in Ithaca. That's what you might be thinking.
Right. 3 dispensaries. We're the only nonprofit, and then there's only 6 nonprofits throughout the state that had a cannabis license right now. And so we think that there is opportunity in terms of whatever profits that we do make, and we hope that we make profits, obviously, that will go back to the mission of the organization, and that the mission obviously is local, and so those dollars will stay locally within the Tompkins County area.
Any other questions? Dan?
Are you saying that any money, any profit that is made will go directly into service provision? There's no other percentages that will go elsewhere?
Well, there's obviously a management services agreement between Challenge and Mosaic. So whatever funding that comes in to help offset, there will be a management agreement between Challenge and Aspire as well. So there will be expenses associated with that, as there is right now. But
they're going to do all of our back office as well. So our payroll, HR, IT, they'll be doing all that, our finance, all of that. But it'll also, so the profits will also go back to support, the wages of our staff. So yes, service provision will be a piece of that, but also I think securing the staff and retaining the staff that know the services and know how to provide that high quality is really where we also need to focus some revenue. I think the job market is really difficult right now. There's a lot of opportunities. So we really want to be able to continue to increase our staff wages so that they do stay and continue to offer those great services.
Stu?
Yeah, listening to a number of the questions certainly stimulates my own curiosity. The initiative in New York State is pretty unique, from my understanding, that they're favoring folks who have past marijuana issues, people who've gotten arrested and so forth. If you explain, I don't know if other states do that as well. But again, that's kind of a unique kind of a payback. So you're going to be employing folks to run this place that are in that category. Also, I think I heard you say in recovery, as well as some of the folks who utilize Challenge Industries. The research that you've done so far, I don't know. It's what made me curious. And Randy's question about the cost. What does it cost to set one of these things up? And you're an LLC, so you're protecting Challenge that way, but you're taking a loan out from Challenge, so you have to pay that back. How profitable will these places, will your place be, to pay back that loan? I hear one of the little quirks is, I don't know if it's happening in New York State, that because the feds have not legalized marijuana, that they can't utilize the banking system. People have to pay cash. Is that the case here in the state? That kind of puts, a blanket on a lot of people who want to be able to utilize, credit cards or, I don't know how that
Yeah.
works.
So you cannot use a credit card anywhere to buy cannabis. You can use cash or you can use an ATM. So most dispensaries will have an ATM, which we will also have in store to obtain cash, but you also can pay with your debit card through the system. So there will be options to use a card. It cannot be a credit card. You legally cannot pay with a credit card.
Okay.
Interesting.
So the cost of starting up an operation like this, a rough number?
So we're leasing the building, and obviously the renovations are going to be our primary cost driver. And until we get those final drawings, I mean, at this point, what our goal is to make it look nice, but we're not going to spend millions of dollars on a renovation,
Right.
especially for a building that we don't own. So it should be pretty minor. Our landlord is paying for all of like the HVAC, electric, plumbing things. Our costs are really going to be just cosmetic, so flooring, a few walls and whatnot. But for the most part, dispensaries are pretty much open concept as far as the shopping area. And then behind the scenes, it's really more about storage. And a lot of the locked cabinetry is like stuff that you just purchase and then you could take with you if you were ever to move your store or to be able to resell. So we don't really have final numbers yet on total cost. We're still working through that with the architect.
Okay, Larry.
Are you able to announce where the store will be yet?
We're working on the press release, but we need to hold off for a bit, just because we are still working through, different approvals with the city. And we also don't want to bombard the landlord with everybody driving by to check it out, but we're getting close. It's on the west end. We will have parking, which I think is also another competitive advantage over the current location that is open.
Any other questions? Jan?
How do you sell, this is just my own ignorance, but how do you sell online and how do you ensure when you're doing that, how do you ensure that the person buying is 18 years old?
So the law, you actually have to be 21. And so basically what you do, so basically online ordering, we do not fulfill or ship it to you. So basically you go online and you kind of reserve it. Once you get to our store, we'll check your ID, verify it's you, collect payment, and then give you your items. We're not able to collect payment online, and obviously we need to see your ID. Yes, there are very strict rules and laws.
Oh, yeah.
So it's sort of just like mobile ordering. It's not.
Yes.
Yeah.
Yep.
Not like
Yep.
online retail.
Yeah, and I think it's a nice opportunity for people who want to really browse and, really read about things. Each product will have descriptions. So people who really want to do their research prior. And, I think since COVID, a lot of people like that express checkout. They like to just come in and get out. I do that with my coffee. I do that all the time. So, really just meeting the needs of the customer. So having some options.
Any other questions?
Good luck.
Thank you.
Thank you
Yes,
very much.
be on the lookout. I just got interviewed by the paper again last week. So I think they're going to be putting a couple more articles together. We really, are hoping for your support and continue to share our message. And I think that this will be a great opportunity for Challenge.
Okay, thanks for coming.
Thank you
Yeah,
for the
thank
invitation.
you.
Appreciate it.
Thank you, Al.
Bye-bye.
Bye.
Oh, now I feel lonely.
We're with you, Larry. It's all right.
All right, moving on. Frank.
Sure. to answer Larry's question about cars, and Harmony, you can help me too. Larry was asking about the new relationship with Cuyahoga Health Systems, and my understanding is, what did they call it? I can't even think of the word. I'm blanking. It's not a merger. It's called something different. Not a collaboration. It's a little stronger than that. Well, I'm sorry?
Alliance?
Alliance. I think that is actually the word. Might be after all this. So they are supporting them. They're kind of under the umbrella. Cars is still doing business as Cars. They're providing back office help. I think similar to what we heard with Mosaic and Challenge, trying to improve the efficiencies of that. And they're also helping with medical staffing, right? That's one of the biggest challenges that we're all facing is how do we staff programs, and the hospital has a mechanism that does that the rest of us could only dream to have from a recruitment perspective and employment and all of those things. So I think it really is about an opportunity for the two agencies to work closely together to hopefully improve care because of that connection, and then also help with the efficiencies and the back office type support that they need. So that's how it's been explained to me, is that, yeah.
Is it Cayuga Health System, Cayuga Medical Center, or Cayuga Medical Associates?
It's technically Cayuga Health now is changed. They dropped the system. Yes, I know. I just got used to saying Cayuga Health System instead of CMC. They're Cayuga Health now. I believe it's under that umbrella. Is how the alliance was formed.
Larry and then Stu.
So will Cars continue to function as a nonprofit with its own board of directors? Who's responsible for the functioning of the entity?
So don't quote me on that, but I believe they are similar to what happened when Schuyler Hospital came under the Cayuga Health umbrella. They maintain their president of their hospital, their board there. I don't know if that will stay that way forever, but I believe that's how they're at least starting out at this point. So yes, and the hospital obviously is a nonprofit as well, with a board of people that we all know and are, community leaders.
Stu?
My understanding is when Cayuga creates that umbrella system, that my friends and colleagues over at the latest family medicine, it benefited them considerably in a lot of ways, particularly in like it's when somebody buys another business similar to theirs. The cost saving is in the secretarial, a lot of the equipment, things that are duplicated in a number of systems. And what is it? There was the orthopedic folks who I think early on were one of the first to do that. And then a lot of other businesses went with that. So I kind of see it as a cost savings policy for a lot of business. And, you work there, you see what goes on, right? It looks like a good idea to create this kind of conglomerate. The only issue I have, personally, was my portal I had to change.
There are downsides to the mergers, though, in that Cayuga Health as a system, even if they want to get rid of the word system, is buying up more and more practices across the region. And I think that lead, between the non-compete clauses in their contracts and other factors, I think that it is not a purely positive thing. I'm not saying it's a bad thing, but I think that it is worth noting that as systems get bigger, there can be problems that come with that.
Yeah, I agree with that.
Yeah, and this is probably a conversation all unto itself, but I agree with that statement. And I also think what we're seeing is a reflection of the intent of, particularly in New York State, to shift to the value-based payment model and moving towards that. And so for the systems, the hospitals, which are the biggest driver of cost, in order for them to have as much control as possible over the entirety of that patient's needs in order to help drive down hospital costs and be competitive with the value-based payment movement. They need to control more and more of the system. And yeah, I think it has its positive and its negatives for certain. I think one of the things I'm most concerned about is we are extremely fortunate that we have a local hospital system. And I think that bore itself out in COVID, right? We were able to have very concrete conversations specific to Tompkins County and get operational very quickly. And it really did wonders for us. And not to say bad things about the other hospital systems, but we couldn't get them on the phone, right? You know, they were busy trying to do whatever it was on their mass
Gotcha.
scale that they're covering. And so that's my concern and my hope, and I've told this to Dr. Stallone too, is that we can support Cayuga Health in, you know, being successful in what they're trying to achieve. So that way we continue to have a local hospital system rather than have them be bought up by Guthrie or by somebody in Syracuse or Rochester that then the people on the board aren't community members that we know and trust and are community leaders, right? And are really looking out for our best interests. So yeah, it's an interesting world, the healthcare world right now. And it's a competitive market, right? It's an arms race almost to a degree, because for every piece of property Cayuga is buying, Guthrie's buying one right next door, right? So it's a really challenging and interesting system to be in right now. And unfortunately, and this is me editorializing, I don't think the focus is necessarily on the patient at this point, right? It's on the financial system and trying to survive and what it is.
Just a quick other piece. I've been in the community a long time now, and when I used to work at the hospital in the 80s, and at the time, I don't know the stats now, in a 50-mile radius, Cayuga, or it was called something else at the time, Tompkins County Hospital was the only hospital in the black in this mile radius, and the only competitor was Guthrie, and that, you know, 40 years later, that still seems to be, you know, I'm gonna put one here, you're gonna put one there, and that's those two have been going at it for a long period of time to editorialize.
Yeah, I know. I learned so much getting closer to Dr. Stallone during COVID and just hearing about what they were going through. I'm glad I don't do that job because it's extremely challenging times. But so that's what we know about cars. If there's interest, we can certainly ask Jessica and or Dr. Stallone to come to the board or the subcommittee, whatever you guys think. So just let us know. I'm sure they'd be happy to. And then the other thing that I wanted to mention was around the opioid settlement fund. So Harmony's been kind of shepherding through the monies for this board. I wanted to give you an update on the county's task force. So we meet tomorrow where they finalized the survey that's going to go out to the public to just gather some information about opioid settlement funds and what people think and to give some feedback. And we are very close to putting an RFP out as well. So we've got kind of a basic framework, and really what I wanted to give you were kind of the buckets. So they're not trying to be super prescriptive, but to give some kind of general ideas of where they'd like to see. And so one of them is strengthening the network related to overdose prevention. So they're interested in prevention work, expanding harm reduction strategies, and workforce investment and collaboration. So those are kind of the three areas that will get called out. I don't think the RFP is ultimately going to limit anyone from for any idea necessarily from being considered, but they wanted to give some framework to folks. And the tentative kind of process, there's about $700,000. They're looking at offering up to 4 3-year $55,000 a year grants, and then 4 $10,000 one-time grants. So it's kind of a mix of the two different types. There's the want to be able to give multi-year funding so people could employ staffing if that's what they chose in order to meet the need. But we didn't want to rule out those folks that might just want to buy a piece of equipment or, you know, whatever it might be to help do that. So there should be those two different opportunities. So that's going on, and there should be more public information coming out as the survey gets launched and the RFP goes out. So just wanted you guys to be aware that that was happening.
Yeah, I guess I have a comment about that. I'm hopeful, but not optimistic that school districts might respond to an RFP. And I was really, looking toward what they did in Oneida County in the schools. Oh, sorry about that. In the schools, as potentially a model for Tompkins County and getting naloxone into the school buildings and doing one pill can kill education in the schools, which to my knowledge is not being done in school districts in Tompkins County. And I'm just going to keep saying that every month. And I'm really, hoping that someone can correct me and that maybe it is being done and I'm just not aware of it. Although I do have a teenager in ICSD and she's not aware of any of that education going on there. So I really think that this county could at least, meet the standard of Oneida County in that regard. And I'm hopeful that some kind of movement or action will take place within the school districts. And I know that if it's an RFP, you can't really control that. They'll either express interest or they won't. My guess is they won't. So.
Well, our prevention providers are BOCES and Alcohol and Drug Council, and that might be something that would fit with them.
And maybe they could be encouraged.
They do, apply
Yeah.
for different things.
Yeah.
Would you be able to send out any links to the Oneida County model?
Sure. I think
That's great.
Yeah, they put naloxone in the schools and it went along with education funding as well.
Frank, I just missed, what is the survey asking in general?
I think it's going hand in hand with the RFP, just wanting to make sure there's nothing that got missed by the task force. Right? Is there something that they should be considering that they didn't? I think generally speaking, we feel pretty confident that they've heard from a lot of the providers. The EMS group is coming in tomorrow. Emergency Medical Services is going to come in and talk about the impact of them. Many of the providers have been in. We've had some folks with lived experience come in and talk. So I think they're feeling like they've gotten a lot of good information, but they want to be as open and transparent as possible. And so it's an opportunity, just one more opportunity to get feedback before they make any decisions about spending the monies.
Okay, thanks.
So has the school district approached us for this RFP? I mean,
Well, the
I know how
RFP,
it works, you get money and then you say, we have this umbrella of this is the use you can use it for. You got a specific program here that, she talks about that would be nice to have locally. I know been in touch with the people you should be in touch with, but have we done, we have any specific requests for this money or the idea of how to use the money at this point, or it's just kind of a generalized?
I think the short answer to that is no.
Okay.
I think there's been some, and Randy, you can share too, because you're a part of the task force. I think there's been some back and forth about how open it should be, right? I think there are some folks that think we should limit it to X number of organizations of this type that are eligible, or X number of, or X value to certain organizations, or X value to certain activities. And I think kind of we've landed somewhere in the middle with kind of putting some structure to the type of money we're willing to give and some kind of umbrella areas for people to think of. But I think one of the challenges that we face is, depending on who you talk to, you get a different opinion or thought about where the money should be prioritized to. And so as a task force, they are tasked with trying to take all of that in and make some of the best decisions possible on how to spend it, or recommend to the legislature how to spend it.
I'll comment on that. The task force is interviewed with Alcohol Council, CARS, REACH. I forgot there's other ones. We usually put it into categories like that was because we felt that we needed to reach a wider group. Education for casual users was a big issue. How people are dealing with that. I don't know how we're going to handle the schools. I know the schools confiscate pills and drugs and don't really know how to handle them completely. They don't test them, obviously. And of course, the drugs are changing all the time, right? And getting worse. So I think the education in schools, or that what you mentioned of seeing that link, I'd like to know more about that. I've been focused on the school side of that.
There was some interesting data. I don't know where it came from. SAMHSA maybe came out last week where they had illustrated a massive spike in adolescent overdoses And that's all related to casual use. That's not adolescent heroin addicts. That's adolescent exhaustion. Oh, it's pretty.
And just a quick conclusion, the word from the school districts, social workers in particular, in the different schools hear that there's money. Or how do we get that money? We have programs, we have ideas we'd like to be hasn't been matched up yet, you've into the agency, but knock on the door of the school system, I think would be a good idea.
Well, even if it's not,
Things with the school districts.
Yeah. Okay.
I was just gonna say, even if it's not the school district, just for an example, it might be cars that's going around to schools.
Pushing it.
And there's all that schools would
Yeah.
need to do is cooperate and let them come in and do these educational pieces.
ADC recently had an initiative like that, which had a lot of posters and postcards and various educational materials that they pushed into various local school districts and into, they shared some with our office, Northeast Peds. So there are some programs like that going on.
Frank, did you have any other updates?
No, I think that's all that I had.
And any other
Our prevention providers have to complete a work plan every year. And they have been expanding like the services that they're allowed to do in school. So some of those services they might be able to do it through their OASIS funding. So it's good to see what they can do through those dollars first. And those work plans are going to be due pretty soon.
Okay.
So can check. I know that like they try and do things on smoking cigarettes and they're not allowed, like you can't use OASIS dollars for anti-smoking programs. So they have like a lot of stipulations because that's a different funding pot in New York State. So, you got to know what.
Nobody's smoking cigarettes anymore anyway. They're all vaping.
Right. Right. So it'd be interesting if you send that out, I can make sure they get it. They can look at it.
Larry?
I just had a quick question for Frank. Last month you told us that you had been appointed to the committee to hire or look at hiring the housing homeless person. Can you give us a brief update about how everything's going with?
Yeah, it's gone really well. We had several strong candidates to consider. We did a second interview process with some finalists, and I believe they're in the process of making an offer now. I of course can't share anything about who they're offering to, but I think it was a good process, and I think when it's all said and done, folks will be happy that we have somebody strong in that position.
So then my question is, at least maybe we could figure out a way to get some feedback and recommendations to that person, from the community services board or from the subcommittees.
Okay. Maybe the best way to do that would be if people would like to email me some feedback, I can compile it and then I can share it back out and we could sort of refine something.
And I imagine you'll ultimately see the successful candidate asking to come to meetings and talk about what your interests and concerns and questions are. I think that's part of the charge from the legislature, is to meet with community partners, talk about what's going on, figure out where the gaps are, and then ultimately make some recommendations to the legislature on how to try to address the situation.
Cool.
Travis, did you?
I'd like to make a comment on that. And you're right, absolutely on that. I think it's really important for this group and other groups to advocate to the legislature what your interests are and what you feel the priorities are, because that's how money is set up. And this is just my opinion. As one legislator, the county has one, so it has large fund balances, but they protect them because they're worried about the sky's going to fall or COVID's going to happen again or whatever. The sky's fallen, and our fund balances have increased. Part of it we had a lot of good amount of ARPA funds that came in. And we use a good portion of that to award to local organizations. But we also spent about 65% of it to do building projects, capital projects for climate change and those kinds of things. But there's still a lot of money there.
Mhm.
So I really think the time is now. It's not later, it's now, for whatever effort you think is important. I'm so confused about what the mental health department does. I mean, in the whole health, I like the whole health, by the way, name a lot. I like that. Whoever came up with that. But I'm learning, which is why I'm here. So I really think that groups like this, you know what is needed, and you need to push harder for it to all your legislators. So just want to share.
Thank you. Travis?
I should know the answer to this question, but with the legalization of marijuana for the state, did that come with any education money around substance use, marijuana, around any drugs? I'm curious.
So there's money. So the Office of Cannabis Management does have a public health component to it, which was pushed for very hard, which I think is where that lives.
Okay.
I don't know how well developed all of that is. I know some of my colleagues are on a state committee to try to inform some of that. I can tell you that my state organization voted to not support legalization. So my colleagues, when they voted, because of the county's position, voted against that, but I was alone, I think, and everyone else, because in theory, if you're ingesting something, you should only be putting air in your lungs, right? That's really what we'd hope, and preferably clean air. So there's a lot of concern about that. I think I'm not going to go down the rabbit hole, but I think we didn't give enough consideration to the public health impacts of incarcerating an entire generation of people of color, but that's another conversation. But I think there is an effort to try to get out in front of this. And I think the governor has made it clear that she's concerned about children and access to it. You heard, them talk about the 21 and how they're going to deal with that. She's put a new push on to deal with the sticker shops. I mean, there's not one dispensary in Tompkins County right now. I mean, I think we all know that. They're just doing it under they're skirting the rules on things. And so the state's put a push on to kind of take care of that. So I'm hopeful that they learned from the tobacco situation. Do I think they put enough money to fully address it? No, I don't think they could. But I think there's some there, and we will start to see some things come out. I don't know if they've directly provided OASIS funding necessarily. I don't think so. I think it's all through the Office of Cannabis Management right now. So
one of the strange phenomenons that I'm hearing is that it's very costly in the dispensary, so it's cheaper to buy it on the street.
Yes.
Yeah.
And so it's created this sort of alternate market.
Yeah.
And my understanding is that it's pretty strong. And we're seeing a lot of potential psychotic break related stuff, especially among folks who've never used it before. And also in edibles, because people ingest, think it didn't work, ingest more. The next thing they know, they've ingested a lot, have all kinds of problems, young underdeveloped brains. I think we're going to see some issues with this. So
yeah,
we're seeing issues in the college, so I'm sure we're going to see issues.
Yeah, there's certainly going to be issues. There's no doubt. I mean, I was going to make a side comment that, wait 20 years and we'll have marijuana settlement funds, at some point, because we're never going to invest enough to get ahead of the problems that it's going to cause. You could say that you're going to save money on the other end, which we hopefully will by not incarcerating people unnecessarily, but how that money gets reinvested, don't take too offense, Randy, will be in our elected officials' hands. And certainly locally, they'll do all the right things. At the state level, who knows where that funding is going to ultimately end up, but we're certainly advocating on every route. I know the DCS group, the Conference of Local Mental Hygiene Directors, has been monitoring it as well. So, we're doing our best to advocate.
One thing I've learned in the legislature is that the feds in the state decide everything. They make the counties do it. Right? I have figured that out.
That's always been true.
So the one thing that has interested me is that the county receives it's got to be $1 million or more, maybe $2 million from gambling, which that money is not allocated for those programs. Correct?
Correct.
Okay, so I just wanted to share that. So as I think.
Is that from the lottery, like lotto? Like the
No,
state lottery?
when they opened the casinos,
Ah,
the new gambling funding, there was each county gets a portion of that. And so we have gotten it. If your question is that going directly to Gambling Anonymous or those types of, not in Tompkins
Those are
County?
addiction things though, way I look at it.
Correct, it is. It's an addiction.
it's similar.
Absolutely. Yeah,
That's my point. Right.
yeah.
But also the state's thinking about ending that and keeping all that money. Right? So.
The legalized gambling in
Well,
the states
the
of
la-
Colorado
the last-
a year, enough to be able to have some profit and give it to the county.
That's
And
As soon
then.
as the casinos open, they're profitable.
Yeah,
And
the
so they've been
casino.
open a few years now. They
Right.
were open for COVID, actually.
Right, I was thinking of like the apps, you know, the.
Oh, the online gambling?
Yeah, the
things?
online
Yeah, I don't know how
I mean,
that.
that's big.
Yeah, right, big. Hear a lot.
Yeah.
I have family members in Colorado, one of whom is a teacher, and one of the things that happened there after legalization for recreation is that the age of onset of use went way down. So
Yeah.
That what?
that's probably what we're
Onset.
headed to.
Use, people started using it.
Access became
Yeah.
different.
Well, our local data shows that nobody's smoking
Right,
tobacco,
right.
right? The tobacco numbers have gone way down in our youth, but onset for vaping and marijuana
Yeah.
is going up.
Yep, I think it's gonna be the Wild West in this county for a while. We'll see what happens, so. Right, any other questions for Frank? All right, Harmony.
So I wanted to just give you some updates on some events that are going to be happening as we, some better weather. There's an event called Better Together for Mental Health, and it's going to be on May 13th in Stewart Park. It's 10 a.m. to 3 p.m. It's Mental Health Awareness Month. And this is going to be hopefully a new event that's done annually. There are a number of organizations that have gotten together who want to put on an event collectively as a group instead of everyone kind of doing their own little thing. So I'm sure some of you have heard about that, but I wanted to make you aware. If you want more information, there's going to be tabling. But every group that tables, they're asking that they do some sort of fun activity as well. There's going to be live music, there's going to be food. It should be a really nice event.
I think the impetus for that was Greg Ailes. Yes,
Say that
I'm
again.
pretty sure that the impetus for that was to honor Greg Ailes.
Yes, that is how it
So
started.
At least
those of
one of
us-
them made
Those,
comments.
yeah, and now it's bigger than that.
It's gotten bigger than that, which is really wonderful,
is,
right?
yeah.
That, so Jada McCune and Josiah Parker are the two contact people. If people want that information, just let me know and I'll send it to you if your agency wants to participate or, other agencies. So the bigger, the better, I think. It's really nice to have something that many people can come to and people remember the event and really have that be our hallmark event in May for mental health. The other one is the Cornell Campus Walk. It sounds really exciting. This is the first time, right? For
It is.
suicide prevention awareness. Let you talk about it.
Was done without any communication with us.
Oh,
So you're gonna,
okay.
it's a little bizarre.
That's a little bizarre. Yeah,
I was mailed a flyer. That's how I learned.
that's how you know. It's happening on
So,
April 30th.
It's a wonderful thing. I'm glad they're doing it. Would
Um,
like to collaborate it a little differently,
Yeah,
but it's a mental health walk on the campus
it is.
for
Melissa.
suicide prevention.
And people can sign up that day.
Yep.
April 30th, it's a Sunday.
It's,
Registration starts at noon.
Who is doing setting up?
I think it was a mental health group on campus. I believe.
Catherine Thrasher Carroll,
So that's how.
very involved in it.
So she must have gotten involved.
And
Yeah.
yeah, she's very involved in it. And then the American AFSP, what does that stand for?
American Foundation for Suicide Prevention.
Suicide Prevention is involved in doing it as well.
Okay.
So that's where that is.
And for local organizations, if they contribute a certain amount of money, then their organizations can get like the assist training, like the
Like first aid.
like the mental
Yeah,
health first aid. So like depending on how much your organization contributes, you can get various kickbacks of like having your staff trained on mental health.
I'll link you with
I know Catherine really well. She's actually in our building. I wasn't aware she was involved.
yeah, she's
Um,
pretty.
Yeah,
really
yeah, at
involved.
least that's great.
Touch base with
Yeah,
her.
I will.
Because, and she also mentioned that, the HR department at Cornell is being really involved and they're gonna do a lot of wellness events for staff there too. So it's really nice to have
Great.
a pretty large event that's really recognizing all the work that people are doing in suicide prevention. So-
Yeah, and just on that HR thing with Cornell, and I can't think of the names right now, but there is someone that's part of HR and then someone that's part of student life that are both responsible for kind of like public health and wellness. And they are working closely together to try to make sure that all the things that they're telling students and providing for students, they're also doing for staff and other folks as well. So it does seem like there's an effort on campus to try to bring things together as much as.
But bring the treatment
We
providers.
gotta
in.
get that. Maybe one more group. I missed that meeting. I don't know. Maybe I was
It's
busy.
good to have.
I don't know.
It sounds like, and it's probably it's the first one, right, that they've done like that, so.
Yeah, and it's a great initiative. I mean. I'm-
Yeah, it's getting some
Thrilled
of the
to
bugs
do it.
out, like making sure you get everyone at the table, right? Because you could really stir up a lot of stuff and people, the clinical staff needs to be prepared. And whenever you do an event like this, you want the clinical staff to be prepared because there could be people saying, I need to talk to someone right now. So that may be a conversation.
We also have a brand new director, so I don't know if he was involved and he didn't.
Probably
share that
not.
out,
I think
so
this was
possible.
happening before, yeah. But I
Big
did.
hill,
It's
a lot of
the
silence.
communication is the hardest thing in any environment, right? It's getting everyone informed that needs to be informed. But that group, the Suicide Prevention Coalition, is where I was hearing about the walk particularly, but I wanted to make people aware in this group that there are a number of work groups in the Suicide Prevention Coalition, in case you're interested in ever participating in them. There's a lethal means work group that is working on getting gun locks out to businesses. The sheriff's department's going to start to give them out to anyone who does an application for a gun, that they would get a gun lock right with that. And there's some other businesses that are doing that. So that's one group. There's a youth work group that's broken into two sections. One is really looking at the college population, another one that's looking at younger students, and they're both doing a lot of activities around training and support. There's going to be a lot of training for K through 12 through BOCES. That's going to be happening. That's a part of it. So they're trying to really coordinate and organize all of those training efforts across the county and have like a one-stop shop. If you were interested in having a training at a school, here's all the things that are offered. Or for college students also joining, I think there's some work on joining Ithaca College and Cornell University's student groups together so that there will be a stronger group of students who are working on preventing suicide. There's a data work group that's really looking at inform the strategic planning process of the coalition primarily, and what kinds of information do we need to help make good decisions. And there's a suicide for healthcare work group that is looking at doing a big activity that promotes people's awareness around all of the work that the coalition has been doing sometime later on. It's just in the infancy of being developed, and an advocacy group that doesn't have any membership right now. So if you're interested in a work group,
To advocate for the
advocacy might be the group that really needs leadership and just a couple of members to work on all the plugging along every they meet. There's a large coalition meeting one month, and then the next month people do their work group meetings.
May I ask, advocacy for what exactly?
So I'd have to look at the strategic plan, which is on our website, but advocating around creating greater awareness, probably funding for things that can help prevent suicide, that sort of thing. So I'm not on that work group, so I don't really know exactly what that all is. But if you're interested, email me. I'll link you up with the right people. And then we did have the opioid funding for the LGU, which was different dollars than what Frank's talking about. It gets really confusing because there's all these different pots of money. And thank you for the members of this group who participated in a very rushed meeting because we only had a few weeks to really put a plan together. Your support was really invaluable. We are gonna, I think I presented two ideas to the group last month. The one was creating sort of like a rapid response team for people who have the most complex and serious needs in our community, who often touch services, but aren't really getting their needs met. They tend to go to the emergency room a lot. They tend to get involved in the criminal justice system for a lot of petty crimes that are really related to their substance use and mental health, to create a team like that. And so that's going to be the primary focus for this first round of dollars. What I've heard is next year when we get our funding, then that amount, whatever that formula, the magic formula that they use, should be sort of the consistent amount we're going to get for the next 16 years. So we'll know better, and then we can create a better process, a more informed, larger group of people having discussions and that sort of thing. But at least we've created some kind of a framework. The second idea that people wanted to look at funding, and it sounds like it may have some overlap with what they're interested in doing with the dollars that are going to the legislature to decide, is around like how to have a response to somebody who has had Narcan from emergency responder, whether it's law enforcement, an ambulance, something like that. And talking to different people about when would be the best time for that. People who are in the field doing that kind of work, they're like, well, not at that time. Like, so would it be 2 days, 48 hours later,
Like a
something
critical
like that? Like some sort of response for
Processing.
that. And I think we need to do a little bit more work, and that might have a lot of overlap with the funding for the other group. So we'll do similarly to what the legislature is looking at, 3 years and a certain amount of money. Like, let's take this first amount of money, which is around 700,000, and devote it to developing one program and sustaining it for a few years. And then each year that group can look at our next amount of funding. What do we want to do with that? And kind of create a plan overall, because you don't have to spend it all at once, which is really, really nice.
Cool.
And we are looking to hire someone for our co-response team with the Sheriff's Department. If you know anyone who might be interested, we're looking for 2 clinical staff people for that team. The co-response team will be a clinical person riding with someone from the Sheriff's Department. They will be in softer marking with their own sort of logo. It won't look like, oh, the police have come. The officer will be wearing a softer uniform along with a clinical person responding. And these will be probably, I think, really addressing the needs of people who don't ever get touched by a mobile crisis team, not necessarily going to call the 988 number, right? These are calls coming through 911, but really have a strong mental health substance use component to them. And it may be the first time we really get someone invited into services. So the position is posted on the county website under career opportunities, under licensed clinical therapist. It's like the third one down. So if you know anyone, that's where they go.
Jessica? 2 questions. One, with the funding, is it similar going to be going through an RFP process?
Working out the details for that, but yeah, it will have to be something like that.
Okay. And then what are the salary ranges for the clinical staff position?
No, you would ask. We can get that for you. It's right out there.
I couldn't find it when I looked on the website.
Oh, you're right.
You have to show.
Yeah, it's in the contract. So in the white collar contract has all the salaries for the positions. We'll get you the number. Our system for hiring is not the greatest. And a large part of it has to do with civil service and how all that works. But the salary is public record and it's out there. I thought it was on the posting.
It's not.
But if it's not on the
It's not on
posting,
the posting, that should
Okay.
be added.
okay, if it's not, then
We'll
we'll
add it
get,
to the posting.
yeah, I don't know what it is. off the
It's
top of
very
my head.
competitive. It's a good salary.
It's pretty decent.
And it's a good position for somebody who's interested in being that first face and the research on the co-response model. If you can do the follow-up within 24 to 48 hours, people are much more likely to engage in whatever services you connected them with if you do the follow-up visit. And they're less likely to die by suicide if they have that second visit. They're They just feel really supported. The model really is not that you just come in the crisis moment. Then you also do a follow-up and you make these connections with someone who may need you again, but are seeing you in this moment when you're saying, I saw you at your worst time. I want you to know I'm still here for you. How are you doing? We talked about some things. Have you followed up? What else can I do to help you? So it's a really interesting model.
Will LMSWs, LMHCs, LMFTs be considered? Is there a supervisor?
Oh, the supervision will come through the clinic.
Okay.
They'll be regular, they're regular employees of the clinic. They're not going to be working for the sheriff's department.
Okay.
So it's
Very good.
both teams. So they'll get all that clinical support.
Do you expect there'll be a similar proposal for the city through reimagining? I mean, is that?
I think they're
idea?
working through their steps about what they
Yeah.
want to do. I have talked with them about like what the model could look like for them as well.
Okay.
But they, I think, are still at a different stage.
Yeah, sure.
Trying to think through how they want it to look.
This may inform that.
It is our hope that it will ultimately cover the whole county and grow. Right? I think our initial proposal required 6 teams to cover the whole town, the whole county, 24/7, or close to 24/7, and we got 2. So we're really talking about Monday to Friday, 10 to 6 is what this is going to cover, which are the high use area hours based on the data that we've seen from the mobile crisis team. So we're trying to be smart about where the timeframes that we apply folks to.
So you need 14 more? Is that- You said you're trying to get 16 and you only.
So I said 6 teams of 2.
Oh,
but
6.
That was the original
Yeah.
large scale
That's
proposal.
16.
Yeah.
Up to.
So we're piloting it, and if it does show success, then we'll have conversations from there.
I really like the idea. I like it a lot. And I think what they've learned from other data, from interactions with public safety, a lot of them are mental health related or substance use related. It's a good, I think it's 40-some%. It's a big number. So.
Any other questions for Harmony? Okay. Is that it for your updates, Harmony? Do you have-
That's it.
Okay. All right, we have nothing else on the agenda, so I'll entertain a motion to adjourn.
So move.
Okay, 1 second. All right. We're adjourned.
So long, Larry.